I would like to ask your permission, both of you, to use this testimonial for educational purpose and on internet.
Yes.
Tell me about your symptoms before the surgery.
I had low back pain, down, and then pain down my hip and down my leg into my foot, numbness.
How bad was that pain?
It was usually like 8 to 9 out of 10.
And a few times you fell, right? You had to go to
yeah.
the ER. Tell me about
Recently,
that. How bad was it?
It was bad. They told me that I was going to have emergency surgery if I came back to the hospital or have to stay in the hospital permanently.
Your leg gave up on you. Is that what happened? Tell me about that. Tell me about the details about why did you fall? Why did you have to go to the ER?
My leg pretty much went numb on me, and I fell into a TV, and then I fell onto the floor, and then I fell into a tub.
Okay. Now, the surgery was yesterday. It was a little more than an hour. It was 1 hour and 7 minutes. And we lost half a cup of coffee. They're telling me you walked. Tell me, how was your day today?
Oh, my day was really good today. I walked quite a bit. And I was actually up through the night, actually walking quite a bit as well.
Okay. Can we have a minute here, please?
Yes, sorry.
So how far did you go for a walk?
All the way down to the end of the hall.
How did that go? How did the walking go?
Oh, it went great.
Yeah. So how is the pain that you had before the surgery? That pain, specific pain you had before the surgery?
It's all gone. It's a new type of pain, just a surgical type of pain.
Yeah,
surgical pain. That I'll have to get used to for a little bit.
Yeah.
But
now, we were planning to do the surgery in the cities, and when you went to the university and you told them your surgery would be 1.5 hours, the anesthesiologist told you that the surgery wouldn't be 1.5 hours, would be much longer, right?
Oh yeah.
Tell me about that.
They gave me a lot of anxiety actually, because of that. And they caused me to believe that my surgery would, not only would it be like super long, like to an 8 to 12 hour surgery, but that it's likely because of due to my size that I wouldn't wake up from surgery. So I had a lot of anxiety because of that.
In one thing they were right. Your surgery was not 1.5 hour surgery. It was a 1 hour and 7 minute surgery.
Yeah.
They were right only in that.
Yeah.
And but they practically they canceled your surgery because of your size and because of your question of your in the past of the blood clot, which was all clear.
Right.
And there was no problem.
Right.
And you're sitting there one day after the surgery, almost ready to go home, and you walked already, and but then the problem is there that not doing surgery in your situation, as well has consequences. You fell, you went to the ER, and so on. What would you want them to know? If you would talk to the person who make a decision and just make it easy, say no surgery for you, what would you tell them?
Listen to your patients and listen to what their bodies are telling you, because really what their bodies are telling you is that their bodies are failing them.
Yeah.
And it's only a matter of time before it becomes an emergency.
Yeah.
And they have to go into emergency surgery, and it becomes an emergency.
Yeah.
And that becomes like a desperate act for them, where it becomes, do I become paralyzed? You
had a previous surgery before, and your discs were in such a bad shape that you need to take them out. And in a traditional surgery, that would be a big surgery. But those hospitals, they should have known it better, because I have been doing that surgery for the last 10 years there. They should have known that this surgery is not a 12-hour surgery. They told you it's a 12-hour surgery.
Yeah.
Is that correct? Or
8
to 12-hour surgery, because if they do it their way, it is.
Yeah.
And I would expect that they should know better, because I have done that surgery there a lot of time. Now they cause you lots of anxiety, right?
Yeah.
That when the anesthesiologist, one anesthesiologist didn't even talk to you, just looked at your chart and canceled the surgery.
Correct.
The other anesthesiologist did talk to you.
Yep.
Don't name names, but what did the other anesthesiologist tell you? about
that was the one that told me about that it would be
Was
an
it
8
12?
to 12 hour surgery.
Okay, but was that person eager to cancel the surgery, or was he? Did he want you to decide? How did that go? What was the details of that?
At first, from what I remember, at first she was gonna go along with the surgery until she received a phone call from the previous
first anesthesiologist.
yeah,
Okay.
saying
You're high
something-
risk and so on.
yeah,
I don't
False
feel
stuff.
you're high risk.
false stuff.
Yeah, I don't feel you're high risk not for my surgery. The hematologist didn't think you're high risk,
Right.
and there are two internal medicine doctors. One didn't listen to you, one listened to you, just gave you a chance to talk and get your story.
Yep.
So tell me about that. The one internal medicine did not spend time with you and said you're high risk, and the other one did spend time with you, wrote with capital letter low risk release for surgery. What was your experience with those two medical doctors?
With those two medical doctors, with the first one who didn't listen to me, it was a very negative experience. Just because he didn't listen to me and he put false things in my records, because he didn't listen to me and give me a chance to explain things or talk through them. He just made assumptions. And then the one who listened to me, it made a whole lot of difference, because he actually went through everything with me, my whole history, spent a lot of time with me, about 30 minutes at least, going through my whole medical history with me, in depth, and making sure that I am low risk.
Yeah. How long do you think the first doctor spent with you?
3 to 5 minutes.
3 to 5 minutes. At least he'd spent 3 to 5 minutes. The first anesthesiologist did not even talk to you.
Right.
Look at you, one chart and done.
Right.
His job was done. So I'm sorry that you had to go through all of that, but the job is done now.
Yes.
You're walking.
No,
You're telling me, are you already feeling better? Well, thank you for sharing this story. I really appreciate. I think unfortunately, there are lots of people in your situation and they deserve better.
Yeah.
Okay, thank you so much. I really
You're
appreciate
welcome.
that.